Dear students and my teacher friends, Namaskar. I welcome you to the presentation lecture on vertebral column. Now, before I start this lecture, I would like to tell you few things about this lecture that in this lecture I have included only 9 points as far as your theory portion is concerned. But the main thing in this lecture is that you observe all the figures that I have included in this lecture. So now I am starting the lecture. The theory part is there, and we will discuss this theory part in the figures. Okay, so this is the point number one. For example, the other names of vertebral column is also known as the spine or the backbone or the spinal column. Now the length of the vertebral column, so it is having the length of 2/5 of your total height. And what this vertebral column is made up of, so this vertebral column is made up of small bones, and these small bones, they are arranged in a series. So we can say the series of small bones that are known as the vertebrae, that structure, that series of small bone or that series of vertebrae is known as the vertebral column, and the singular is vertebra. So in other words, we can say many vertebra join together and they form the vertebral column. Now the skeleton of the trunk. Now the skeleton of our trunk is made up of mainly the three things are involved. For example, the vertebral column, the sternum, and the ribs. Together, these three, that is the vertebral column, sternum, and ribs, they are making the skeleton of the trunk of the body. So I am showing you in the figure. This is the vertebral column that today we are going to discuss about this. Okay, then for example, over here in this figure, as you can see, this is the this one is the vertebral column. These are the ribs. Okay, and we cannot see the sternum because this is the dorsal view of our body, that's why, and sternum is visible from the ventral surface. So you can imagine that the vertebral column, then this ribs and sternum. So these three things together, they are making the skeleton of the trunk. So this is the skeleton. This entire thing is the skeleton of our trunk. Okay. Now, what this vertebral column is made up of? So as I told you earlier, it is made up of bones and as well as the connective tissue. Now, inside the vertebral column, the spinal cord is present, or we can say the spinal cord is surrounded by the vertebral column, and at the same time the spinal cord is protected by the vertebral column. And we know the spinal cord is made up of the nervous tissue as well as the connective tissue. So I am showing you this in the figure. For example, here you can see this is the vertebra, this one is the vertebra, this one is the vertebra. Okay, so many vertebra, they are joined to each other and they are making the vertebral column. And inside the vertebral column, as you can see in the yellow color, this is the spinal cord and it is protected by the vertebral column. Over here, as you can see, this is the cross section of one vertebra is shown, and inside in the cross section, this yellow color part is the spinal cord. So we can say the vertebral column is protecting the spinal cord. That is the meaning of this thing. Now we are moving forward. Okay, so few points we have covered. Now the fourth point, the length or the height of the vertebral column. So in adult male, the length of vertebral column is 71 centimeter, that is 28 inch. And when we talk about the length of vertebral column in female, so in adult female the length is 61 centimeter, that is 24 inch. Now this vertebral column is acting like a strong flexible rod in our body, and with this flexible rod we can move forward, we can move backward, sideways, and we can rotate our body also. So this vertebral column is enabling us to make certain kind of movements of our body. Now, what are the other functions of the vertebral column? So, as I told you earlier, that the spinal cord is surrounded by and it is protected by the vertebral column. Then, on the top of the vertebral column, we know the skull is present. So, the head, that is our skull or the cranium, is supported by the vertebral column. For example, the first vertebra, first cervical vertebra. So on the first vertebra, our head is present, and so we can say our head is supported by the vertebral column. Okay, and the vertebral column is also serving as the point of attachment for the ribs, pelvic girdle. Okay, and at the same time some of the muscles of our back and ribs, they are also attached to the vertebral column. Okay, so this is the fifth point, you can go through this point also. Okay, now the number of the vertebra. Okay, now during the fetal development, during the pregnancy, the number of vertebra is 33. But as the baby has born and after the birth, the child grows. Okay, so after the growth, the number of vertebra is decreasing. So the child is growing, and when the adulthood is gained, that time the number of vertebra is 26, because some of the vertebra of sacral region and the coccygeal region, they join together, they fuse together. That's why the number of vertebra in adult human is decreasing. So this point we remember that the in early development period the number of vertebra is 33, and during the adulthood the typical vertebral column contains 26 vertebra. So this is the sixth point. Okay, then the point number 7, the name of the vertebra. Okay, so first 7 vertebra, 1 2 3 4 5 6 7, this 7 vertebra, they are present in our neck region. So cervix means neck, and they are known as the cervical vertebra. First 7 vertebra are the cervical vertebra. In the figure I will show you all these vertebrae, but right now I am telling you the names. Okay, then the 12 vertebra, they are present in the thorax. Thorax means our chest. Okay, so we can say the chest vertebra are known as the thoracic vertebra, and their number is 12. Okay, and where they are present, so these 12 vertebrae are present posterior to the thoracic cavity. Okay, so posterior to our chest, these 12 thoracic vertebrae are present. Okay, now there are 5 lumbar vertebra, and this lumbar vertebra, what they are doing, so they are supporting the lower back, our lower back of our body. Now there is one sacrum vertebra, and sacrum means sacred bone. Okay, and what is sacrum? One sacrum is made up of, so 5 fused sacral vertebra. What is happening? 5 vertebra, they are fused together and they are making one sacrum vertebra. And coccyx, one coccyx vertebra is there. Now how we are going to read this coccyx? It is actually coccyx. Okay, many a time we are speaking coccyx, but actually it is a coccyx, but this is difficult, so generally we are speaking like this coccyx. Okay, so coccyx is equal to cuckoo. Why this vertebra is named as a coccyx? Because this vertebra looks like, it resembles like the bill of a cuckoo bird, so that's why it has given the name of coccyx vertebra. And this one coccyx vertebra is made up by the fusion of 3 to 5. Remember this thing. Here, over here it is written 4, but I am telling you 3 to 5 coccygeal vertebra fuse together, join together, and make one coccyx or coccyx vertebra. Okay, now in the figure I will show you all these vertebrae. So as you can see, this is the vertebral column, and this is the first one, pars cervical. So this is known as the atlas vertebra. Then the second one is known as the axis vertebra. Then third cervical vertebra, then the fourth, then the fifth, then the sixth, then the seventh. So there are 7 cervical vertebra. Now you can read this information. Okay, what is written? 7 vertebra make up the spine in the neck. Okay, so basically these 7 are the vertebra of our neck region. Now our thorax region vertebra. So as you can see, this is the T1, T2, T3, T4 up to T12. Okay, so up to T12. So from T1 to T12, these are thoracic vertebra. And what is written over here? So 12 vertebra, for example, over here, as you can read this, 12 vertebra providing attachment for 12 pair of ribs. Okay, now I will show you this, how they are providing the attachment for the ribs, so you will get the idea. For example, can you see this? Okay, here it is written demifacet for the rib joint. So now you can understand the rib joints over here. Okay, so the ribs are joining over here, that's why it is known as the demifacet for the rib joint. Okay, the place where rib comes and it joins with the vertebral column. Now lumbar. Okay, how many lumbar vertebra? So as you can read this, there are 5 vertebra. This is L1. Okay, this is L2, L3, L4, and L5. So these 5 are the lumbar vertebra. Okay, 1, 2, then this way, 1, 2, 3, 4, and the last one, this one, 5. So these 5 are the lumbar vertebra. Then sacrum, 5 fused vertebra. For example, S1, S2, S3, S4, S5. Okay, so these 5 fuse together and they are making one vertebra. So this entire vertebra, okay, so this is known as the sacrum. This one is the sacrum. Over here, this one is the, for example, this one is the sacrum. Now the last vertebra. Okay, now here, as you can see, this 3 to 5 vertebra. As I told you earlier, 3 to 5. Over here they are showing 3, coccyx 1, coccyx 2, coccyx 3. These 3, for example, this one and this one, these 3 fuse together and they make a single vertebra, and this vertebra is known as the coccyx vertebra. So now we are moving forward with this. We have completed the point number 7. Now the curves, okay, curves of the vertebra. This is also very easy. Let me show them. For example, I have reduced the size that so that you can see properly. Now, as you can see over here, this is 1, this is 2, this is 3, and the fourth. Okay. Now, as you can see, the with the blue color, this one. Okay. These are the 7 cervical vertebra, and this is this shape. Okay. So this is the convex. Okay, now what I'm trying to explain you, that as you can see over here, it is written, when we are viewing the vertebral column from the anterior or posterior side, so the vertebral column appears straight. For example, as you can see, this is the dorsal view. This is the dorsal view of the vertebral column, and this one is the ventral view of the vertebral column. So in both the views, dorsal and ventral, the vertebral column looks straight. But over here in this figure, okay, so when we are looking from the side, okay, so we can see it is not straight, but it is having some curves. Okay, so the point number 8 is something related with the curves. Okay, so as you can see, when we are viewing the vertebral column from the side, it is showing 4 bend. Okay, as you can see, 1, 2, 3, and 4 bends are there, and these bends are known as the normal curves. Okay, now with the blue color, as you can see, with the blue color, this is the cervical curve. Okay, this one is the cervical curve with the blue color, and the third one, the third with the green color, okay, the lumbar. These are convex curves. Okay, so as you can see, this is the cervical curve, this one is the lumbar curve. Okay, and both of them are having the convex surface. This is the convex, okay, bulging out. Okay, but the thoracic thoracic and the sacral curves, for example, the red one and the blue one. Okay, so this one and last one. Okay, so thoracic and sacral curve, they are concave curves. Okay, they are cupping in. Okay, now So you need to remember which one is the convex curve and which one is the concave curve. Okay. Now, what is the role, why these curves are present? So what these curves are doing, so these curves are increasing the strength of the vertebral column, and they are also help to maintain the balance in the upright position. For example, when we are standing, so that time the maintenance of balance is performed with the help of these curves. Okay, and since the bands are present, so vertebral column is able to absorb the shock, absorb the shocks when we are walking, and at the same time these curves are also protecting the vertebral column from the fracture, because the vertebral column is made up of, as we know, the very delicate bone that are the vertebrae are there, and these curves are protecting this vertebra from the fracture. Okay. Now the fetus, okay, the fetus has only the single anteriorly concave curve throughout the length of the entire vertebral column. So we are remembering this point, that in the fetus only single anterior concave curve throughout the length of the entire vertebral column is present. Okay, so as you can see over here, the only single concave curve is present in the fetus. Now the last point, okay, intervertebral disc. Now what is intervertebral disc? Okay, now I am showing you this. Okay, for example, here you can see this is the T4, fourth thoracic vertebra, and this is the fifth thoracic vertebra, and between them, as you can see, this one, okay, this part is the intervertebral disc. Now what is this intervertebral disc? Okay, intervertebral disc is the, as you can see, it is written over here, so it is a weight bearing cartilaginous joint. Okay, and weight bearing means basically this thing, okay, this is actually absorbing the shocks, or this intervertebral disc can bear the weights. Why it is able to bear the weights? Because it is, the outer part is made up of cartilage, that is the fibro cartilage. Okay, and the inner portion is known as the, inner part is the known as the nucleus pulposus. So once again, the outer portion that we are looking right now is known as annulus fibrosus, and it is made up of fibrous ring, and inside the pulpy part is present, that is not visible right now. That part is known as the nucleus pulposus. So in other figures I will try to explain this thing. Now this intervertebral disc, they are responsible for the 20% height of the vertebral column. Okay, now the outer part of this intervertebral disc, okay, they are made up of fibrocartilage. Okay, approximately 12 rings of fibrous cartilage are present, and these outer cartilaginous rings are known as the annulus fibrosus. Okay, and this annulus fibrosus, as you can see, annulus means ring like, so there are 12 ring-like fibrocartilages are present, and inside this fibrocartilage there is a soft, pulpy, slightly elastic substance. Slightly means, sorry, highly, very highly elastic substance is present. It is a gelatinous substance, and that substance is known as the nucleus pulposus. So we can say inside the gelatinous high elastic substance which is present, and it is a gel like, okay, so that substance is known as the nucleus pulposus. So in the figure I will show you this. Now before that, now what is this intervertebral disc is doing? So this disc is making the strong joints, and it allows to perform as various kind of movement. For example, the bending bending movement or the rotation of our body, okay, and we can get the shocks. So the shocks are absorbed by the intervertebral disc, okay, and when we are bearing the weight, that time this intervertebral disc is flat and broad. For example, I will show you in the figure, so that, for example, this is the normal intervertebral disc, and now you can see the change in the position of the intervertebral disc. So this is the intervertebral disc at the time when we are bearing the weight, okay. If someone is holding the weight, okay, and it is if the person is uplifting the weight on his head, so that time the position of the intervertebral disc will be like this, okay. So it is a flat and it has broadened up. So basically this is kind of a joint, okay, and it is a shock bearer, okay, then it is a weight bearer, shock absorber, and also allows to rotate our body, okay. Now in the figure I will show you this thing. As you can see, this is the intervertebral disc is shown over here, and the outside, as you can see, annulus fibrosus is present. So it is a ring of tough fibrocartilage, and it is known as annulus fibrosus, and inside the gel like core is present. It is known as the nucleus pulposus. Now I will show you the other figure so that you can get the idea. For example, this is the beautiful figure, so you will get the clear cut idea, okay. So here you can see nucleus pulposus, pulpy substance, highly elastic and gelatinous, okay, that is known as nucleus pulposus of disc. And outside I told you that approximately 12 fibrocartilage ring are present, and these rings are known as annulus fibrosus. So outside annulus fibrosus is present, okay. Now here you can see annulus fibrosus and the nucleus pulposus. Now here also intervertebral disc is shown, and this is the MRI of the lumbar region, okay. And now I am explaining this point, herniated nucleus pulposus, Okay. Now, what is the meaning of this? This is the last point of our discussion, so I am explaining this point also. Let me open the file once again. Okay. Now, as you can see over here, this is also important point, herniated disc. Now, what is happening over here, that sometimes uh, we we get injuries. For example, a person is experiencing the accident, or his leg slips. Okay, so at that time, due to the jerk, what is happening, the pulpy part which is present inside the jelly like part, or the highly elastic substance, ooze out, it is coming out. Okay, so now, as you can see, the nucleus pulposus is coming out. And what this pulposus is doing, so you can see this is the spinal cord and these are the spinal nerves. So this pulposus which came out, it is applying the pressure on the spinal nerves as well as the spinal cord. So the person is feeling the pain. Okay, so this phenomena is known as the herniated disc. Now, the orthopedic doctor will perform a surgery, and what the doctor will do, that, as you can see, this is the lamina and this one is the lamina part, and this one is the spinous process. So with the surgery, doctor will remove this lamina as well as the spinous process, so to reduce the pressure of this pulposus on the spinal cord and the spinal nerve. Okay, so there will be a relief from the pain. Okay, and as you can see over here, one plate is inserted in place of the lamina and the spinous process. So this thing, this entire phenomena is known as the herniated disc, or sometime it is known, this condition is known as the slip disc. So this is the slip disc or the ruptured disc. Okay, now before I wind up this lecture, I would like to show you the curvatures. So over here you can go through this. For example, this one is the cervical curvature. Okay, and information you can go through this. Okay, then thoracic curvature. Okay, I have already explained. Then over here, this is the lumbar curvature, and last one is the sacral curvature. Now, one by one, I will show you all the figures. Okay, the entire lecture I would like to show you. Then these are the figures. So you need to carefully observe these figures. Okay, the views, anterior view, and on right hand side, right lateral view. Then 7 plus 12 plus 5. Okay, and the sacrum and the coccyx. Okay, so as you can see, one sacrum, one coccyx. Okay, 7 cervical, 12 thoracic, 5 lumbar, then the intervertebral disc. Then in this figure, okay, the number of vertebra. Then this figure, anterior posterior view. Then this figure, then the curves, okay, adult human and the infant, the fetus curve, then the intervertebral disc, then this information. And this thing is not